Μαζί μας είναι ο καθηγητής Κ.Ε.Σ.Γ.Χ, που έκανε 2 εισηγήσεις σχετικά με 2 πρωτοποριακές τεχνικές στη Σιαλενδοσκόπηση και την κλειστή ανύψωση ιγμορείου. Mr. Nahlieli, thank you for being with us. Tell us, how important salivary glands are for our general health and oral health also, and what problems can interfere with their function?
Salivary glands are very important to your life. Salivary gland, it's lubricant that you have in your mouth, and it helps to swallow. It protects your teeth, your mucosa, your all over the oral lining, and without saliva, it's quite difficult to live. There are many problems that you can have with salivary glands, but my part is to help patients that have stones or obstructions of the salivary glands. Like you have stones in the kidneys, in the urinary tract, we have stones inside the glands, inside the duct of both the parotid gland and submandibular glands. About 1% of the population, they suffer from salivary gland stones, and in the past, before we began with our technique, surgeons have to remove the gland. If submandibular, to open the neck and to remove the gland. If it's in the parotid, to open the face and to remove the gland. And such a surgery, it's quite unpleasant. It's okay if you remove glands because you have a tumor, but to remove a gland due to a stone or infection, I think it's not fair for the patient. Like if you have stone in your kidney, your urologist don't remove your kidney. So before about 2 decades, we invented a technique, endoscope, very small endoscope, that is about less than 1 millimeter, that we can penetrate to the ductal system, and we can remove only the stone and the obstruction, and the patient can stay with his gland.
What are the benefits from your developments and innovations in salivary gland surgery?
As a benefit of the patient, that they will stay with the glands, because if you remove a gland, one submandibular gland, it means that you will have less 30% of your saliva. And if we remove a parotid gland, you have less 40% of your saliva during mastication. So the benefit of the patient that he will not need to be operated in removing glands, and we only remove the problem. We remove the stone, we open the obstruction, strictures, and the patient can stay with his gland without incision in the neck or in the face, without problems like damage to nerves like the facial nerve or the lingual nerve. And this is innovation like in general surgery. Nowadays, they don't open your and remove your gallbladder or your kidney. They insert endoscope and do it, and they are doing it under minimal invasive surgery, and this is exactly what we are doing.
How successful is your endoscopic salivary gland surgery for patients suffering from salivary gland problems?
Mainly, most of the cases we can perform the surgery under local anesthesia. We insert endoscope, very small endoscope, and in most of the cases the patient can go home on the same day. We are doing it under local anesthesia. If we are doing it under a general anesthesia, so the patient usually, it's overnight, and the next day he can go home.
Professor Nahlieli, let's move to your second presentation that had to do with minimal invasive sinus elevation and surgery. Tell us first, what is sinus elevation and when it's necessary?
Usually when patients need implants in the upper jaw, in the area very near to the sinus, usually in many cases they don't have enough bone for stabilization of the implant. We need at least 10 millimeter of bone that we can insert implant that it will be stabilized, and in the area of the sinus, in many cases, especially in elderly patients, we do not have enough bone to stabilize the implant, and in the past we had to open the sinus and to insert a bony substitute, and then to insert implant.
What might be the problems for the patient?
There are a lot of problems. First of all, it's quite a big surgery that the patient that the dentist has to operate in his clinic. It means that the patient, we need to open the sinus to elevate the membrane, and usually the patient, it's very unpleasant to the patient. He will have swelling. There are complications like sinusitis, infection of the sinus, bleeding, and also it can be not only in the first week or months, but it can be years after the surgery that the patient can suffer from this surgery.
What are the benefits from your developments and innovations in implant surgery?
The innovation is that, like in every other part of the body, nowadays surgeons like to perform minimal invasive surgery. Minimal invasive, and what we are doing, we do not penetrate the sinus. The innovation is implant that we insert it into the sinus, near the sinus area, and via the implant, through the implant, we inject bony substitute. So more or less, it like normal implant. The patient, they don't suffer, no swelling, very low rate of infection, no risk of bleeding. So the benefit of the patient that he will not suffer. He can go immediately to work. The success rate is very high. So I think the benefit for the patient and also for the dentist is huge.
Thank you very much.
Thank you.